Oh.
I am Simon Fisher, the Radiology NCO within Treatment Platoon. Today, we're going to talk about how you can help save your battle buddy's life. All right, today we'll be discussing sharps containers, and their importance. All right. So, what are sharps? Hampton.
Anything that's sharp that comes in contact with an individual's skin or blood.
Actually, very good. The OSHA's definition of sharps is sharps objects that can penetrate a worker's skin, such as needles, scalpels, broken glass, capillary tubes, the little tubes that you break off, or exposed ends of dental wires. Okay, so pretty much, if you touch it and you say, "Ow, that's sharp," it falls into this category.
Sharp.
Okay. So the next question is, how do we dispose of these things?
Put them in a sharps container.
Put them in a sharps container. That is one way to do it. First and foremost, what you should not do is try to recap a contaminated sharps object, okay? By doing so, you run the risk of actually penetrating yourself and infecting yourself, all right? And that's per OSHA. I know some of the field medics have been kind of taught differently, but this is, once again, per OSHA. Some of the ends of the needles have safety devices in which you can push or clamp over the needle so it'll actually stop you from getting pricked by it, okay? As quickly as possible after the use of the needle in a person or patient, dispose of it in a sharps container. Thank you, Tulsi. So, what's a sharps container? No, you already answered one.
A container in which you dispose of sharp objects.
Thank you for the roundabout answer.
Thank you.
That's a sharps container.
What?
Okay? FDA, the Food and Drug Association or Administration, pretty much states that sharps containers are the big red bins or small little red bins that are made of rigid plastic, puncture resistant, and leak proof. Okay? So the needles don't come through and poke us and the blood doesn't spill out. Okay? These containers, while working in the medical field, should be accessible. All right? Most of them are located wherever sharps are used and stored. Okay, so even in the storage area, you should have a sharps container readily available just in case something happens. All right. With these sharps containers, the ones that are purchased for specifically this, there is a line on there that says full. All right, it's normally 3/4 of the way full. Right? You don't go past that point. All right? If you do, you run the risk of overfilling and some yahoo trying to put more needles in there and then getting stuck. All right. There are alternate ways in which we can have sharps containers. If you're at home and you have a mom that's diabetic and she takes insulin shots, all right, you can actually take a hard, rigid plastic item that is sealable, that is leak resistant or leak proof, and use that as sharps container. In the picture here, you can notice they're using a laundry bin. Excellent. A water bottle. Want to pass it over? A water bottle. All right. Contains water, leak resistant, rigid plastic, and sealable. All right. Once it's done, you got to make sure it is labeled so anybody else that comes up behind you and tries to throw it away or use it knows what's inside of it. Okay. Once again, do not fill it past 3/4 of the way full for the same principle of, hey, you don't want to stick yourself or have your battle buddy stick them. Okay. Why is any of this important? Bad stuff, right? Right. In the medical field, we deal with patients that are sick. Right? One of the main reasons why this is extremely important is because of bloodborne pathogens. Right? You don't know what the patient has. Right? You don't know what somebody else's patient has. Okay, so when you stick yourself with a contaminated object, i.e. a needle, because that's primarily what we use, it will have either hepatitis B, hepatitis C, HIV, or a plethora of other bloodborne pathogens. All right? Some of these pathogens are not healable, i.e. HIV, AIDS. You can't get rid of it. Okay? So one little stick can cause you a lifetime of pain. You don't want that. All right? OSHA's definition for bloodborne pathogen falls underneath the regulatory waste definition of liquid or semi-liquid blood or other potentially infectious material. All right? Items that contain or have contained blood which release a substance in a liquid or semi-liquid state if compressed. All right? It's actually quite important. Items that are caked or dried. Right, so when we use a needle, after a while the blood will dry up. That dried blood is still bad. All right. Contaminated sharps, nice big bold letters. All right. They even put it by itself. Pathological or microbiological waste that contains blood. Okay. Now, if you're asking yourself, what about a Band-Aid? Honestly, that's not really underneath biological waste until it's a pool of blood. Okay? Band-Aids are designed to absorb, fold it over, and seal itself. Right? Before anybody asks questions about Band-Aids. However, surgical sponges and all that stuff falls underneath regulatory waste. Or regulated waste. I know we're young, or y'all are young, I'm old.
See,
And money speaks louder than most things. All right, so here's some of the financial burdens that can actually be given by OSHA. If nobody's ever dealt with OSHA, I used to in the construction area. They are a pain, and they will find things to be wrong. All right. The initial fine for overfilling a Sharps container is $540. The very first one they see. Okay, and the fines increase from there. Initial fine for inadequate training. What we're doing right now, hopefully, is adequate. All right, $800 for the group. So in other words, the hospital and/or Charlie Company. Okay. Maximum fine for failure to use safety devices. Guess what? Sharps Containers is a safety device. You can see the regulation, it's $70,000. If you're asking yourself, nobody ever really gets gigged with these, now do they? Actually, in 2003, there was a nursing home that had $92,500 worth of fines given by OSHA. $22,500 were given for a variety of things. $70,000 was given for failure to use safety devices. One shot. Okay. So yes, these things are very important, and we do use them on a daily basis. Even out in the field, we need to use them, right? And definitely while we're in the hospital. OSHA does have regulations over us, even though we're in the Army. Okay, it becomes even more important when we're working with civilians. Okay. Just in case you want to do a little bit more research, here's all the resources which I used. Trust me, there are pages upon pages of OSHA and the FDA, and every hospital has their own different guidelines on what to do with Sharps. Next time you're working around Sharps objects, working with patients, know you have the ability to save your battle buddy's life just by simply putting a Sharps container. Any questions?